Hello, my colleagues, and hello, my friends, and hello, my students, and hello, my patients, and all my fans. Today I will talk about fasting for diabetics. What about the diabetic patients during the holy month of Ramadan? Of course, this depends on the type of the patient. For every patient, we can tailor his regime or her regime during the holy month of Ramadan according to many factors, according to the age of the patient, the type of diabetes, that is whether the patient is on oral medications like in type 2 diabetes, or the patient is on injections like in type 1 diabetes. So the type of diabetes is very important, and also the severity of hyperglycemia is important. That is how much the blood sugar is under control before the month of Ramadan. That's why the most important for the proper management of diabetes during the holy month of Ramadan is to prepare the patient before the start of the holy month of Ramadan and put his blood sugar under proper control, and then we adjust the medications during the holy month of Ramadan. So the most important was before the start of the holy month to put the blood sugar under control. فهو هنا أهم شيء إنك تظبط المريض قبل شهر رمضان so that the blood sugar will be under control, and then we can adjust the medications, the timing and the doses during the holy month of Ramadan, that is with the start of or with the beginning of the month. So the severity of blood sugar also is important in determining what the patient can do during the month of Ramadan. Severity of hyperglycemia as determined by the fasting blood sugar, the post-meal blood sugar, that is 2-hour postprandial blood sugar, and the hemoglobin A1C, which is the summation or which is the result of the both the fasting and the 2-hour postprandial. So these three together can determine the accuracy of control of blood sugar on the short term and on the long term, that is over the past few weeks or months before the start of Ramadan. And also it depends on the regime, and the scheme for each diabetic will depend not only on the type of diabetes, whether he is on oral or on injectable medications, and on the age of the patient, as I mentioned, and on the severity of hyperglycemia, also on the duration of diabetes, for how long the patient is diabetic. Is he a chronic diabetic for years, or he is newly diagnosed diabetic patient, and also on the presence or absence of other comorbid conditions like hypertension, like lipid disorders, like coronary heart, like chronic renal disease, like any liver problem, any other organ or systemic disorder. This is very important to determine. Is there any a target organ damage, that is any diabetic kidney disease, any diabetic heart disease, any diabetic eye disease, any diabetic brain disease, any diabetic neurological problem, any neuropathy, peripheral or visceral neuropathy. So the presence of any organ damage is important in consideration of the regime during the month of Ramadan, and also the presence of other comorbid conditions, as I mentioned, like hypertension and like lipid disorders, which is a common association with diabetes, as we all know, because we know that in the diabetes there is a metabolic disorder, and there is usually an associated hypertension in many cases, and there is an associated dyslipidemic problem, that is hypercholesterolemia or hypertriglyceridemia or mixed dyslipidemia or mixed hyperlipoproteinemia. So we have to consider all of these in the determination of the regimen which the patient has to follow. But in general, all patients with diabetes who are on injections and they are liable to get hypoglycemia during the fasting hours, they should not fast. This is a clear rule that all patients who are on injection, especially children with type 1 diabetes who are on insulin therapy, or young adults, I mean, because anyway, the children, they are not allowed for fasting. Children only fast Ramadan after they get adults, that is 12 years or older. Before that, from the religious point of view, they are not allowed to fast the holy, and they are not ordered, and it's not a must that they fast. ليست واجب ان هم يصوموا بالنسبه للاطفال، وبالنسبه يجب ان يكون الشخص بالغ عاقل. ان لم يكن بالغا ولم يكن عاقلا، حتى لو بلغ غير عاقل فهو ليس اهلا للصيام. دي من شروط الامور التعبديه وفرضيتها على الناحيه الشرعيه من الناحيه الدينيه from the religious point of view. So I'm speaking about the young adults, that is older children who are diabetic and they want to fast during the holy month. Those cases that older children with diabetes, that's type 1 diabetes, and they are on insulin therapy, as we all know that most of them, they are on 2 or 3 doses of insulin, or sometimes 4 doses. Such patients who are on what we call basal bolus regimen, they should not fast because of many things. Number one, they are liable to get hypoglycemias, and this is dangerous. And their blood sugar also levels are liable to fluctuate. They are undulating blood sugar and swinging blood sugar levels if they are allowed to fast during the holy month of Ramadan. So for these two important problems, especially the hypoglycemic episodes, which are more frequent and which might have the chance to occur during the fasting hours, those cases should not fast at all. كل الأطفال وكل الصغار السن اللي عندهم سكر وبياخدوا حقن انسولين لا يجب أن يصوموا على الإطلاق. الصيام ممنوع عنهم، لأن ربنا سبحانه وتعالى زي ما قال في آيات الصيام في سورة البقرة: يريد الله بكم اليسر ولا يريد بكم العسر ولتكملوا العدة ولتكبروا الله على ما هداكم ولعلكم تشكرون. فيريد الله بكم اليسر، ربنا سبحانه وتعالى يعني زي ما قال في آيات تانية: ولا تقتلوا أنفسكم إن الله كان بكم رحيما يا أيها الذين آمنوا لا تأكلوا أموالكم بينكم بالباطل إلا أن تكون تجارة عن تراض منكم ولا تقتلوا أنفسكم إن الله كان بكم رحيما ومن يفعل ذلك عدوانا وظلما فسوف نصليه نارا وكان ذلك على الله يسيرا. بالعكس، اللي يعمل كده ويهلك نفسه ديابيتك وبياخد انسولين وعايز يصوم ويعرض نفسه للخطر هو يعاقب. هنا يجب نحن نفهم الفقه من العبادات ايه. يعني ان ربنا سبحانه وتعالى بالمؤمنين رحيما وكان بالمؤمنين في آية تانية هنا: وإن الله كان بكم رحيما في آية البقرة. ولا تقتلوا أنفسكم إن الله كان بكم رحيما. وفي سورة الأحزاب ربنا بيقول: هو الذي يصلي عليكم وملائكته ليخرجكم من الظلمات إلى النور وكان بالمؤمنين رحيما. فهو ربنا رحيم بينا. تحياتهم يوم يلقونه سلام وأعد لهم أجرا كريما. فربنا رحيم، وهو قال على نفسه كده، وهو معروف ان هو الله سبحانه وتعالى رحمن رحيم. هو رحمن الدنيا والآخرة. وبعدين الله سبحانه وتعالى يريد الله بكم اليسر في آية تانية قال: ولا يريد بكم العسر ولتكملوا العدة ولتكبروا الله على ما هداكم ولعلكم تشكرون. وفي آية تانية قال: وما جعل عليكم في الدين من حرج. إذن كل الآيات بتقول إن ربنا سبحانه وتعالى مش عايز إن هو يتحدانا أو يحطنا في مواقف صعبة أو يهلكنا. بالعكس، هو من مقاصد الشريعة كمان الخمسة في حفظ الضروريات الخمسة، اللي هي حفظ النفس، حفظ الدين، وحفظ النفس، وحفظ العقل، وحفظ العرض، وحفظ المال. اللي ما يعرفش بقى حاجة اسمها مقاصد الشريعة، دول مسلمين. اللي بيصوم شهر رمضان ده مسلم، فلازم يكون يعني يتفقه في الدين. ومن فقه الدين انه يعلم ان مقاصد الدين بتاعته بتقول مقاصد الشريعة 5: حفظ الدين، الواحد يحافظ على دينه، دي اهم حاجة. وبعدين حفظ النفس البشرية نفسها، الجسد والعقل والكينونة البشرية اتكلمت عليها من يومين. فهنا حفظ النفس، وبالتالي هنا أي حاجة تهلك النفس تبقى حرام. أي حاجة تؤدي إلى هلاك النفس حرام. ولا تقتلوا أنفسكم إن الله كان بكم رحيما. آية واضحة في إيه؟ لأن لا تفيد النهي، والنهي يفيد التحريم. فحرام على الشخص إن هو يقتل نفسه، هذا ظلم للنفس ومعرض للعذاب والعقاب في العالم الآخر. فإذا هنا all diabetics who are on insulin they should not fast. ويقدروا يتصدقوا ويعملوا كفارة بقى عن كل يوم في كفارة، بس بمنتهى البساطة. أما إن هو يصوم ويعرض نفسه للهايبوغليسيميا because hypoglycemia is more frequent because the blood sugar is not properly controlled over the around the clock, that is over the 24 hours period of the day and night. So this will result in uncontrolled diabetes. And the more important is the increase the frequency of hypoglycemic episodes during the fasting hours, which might predispose to, in severe cases, to hypoglycemic coma, which is very dangerous, damage the brain. So here, all diabetics who are on insulin, whether young adults with type 1 diabetes and also type 2 diabetes in adult patients, in adult populations, they should not, on insulin therapy, that are taking insulin, they should not fast. Especially the elderly, because the elderly are more liable to complications and they are more liable to hypoglycemic unawareness, what we call hypoglycemic unawareness. And they might get myocardial problems, they might get cardiac ischemic events, they might get cerebrovascular ischemic events, so which might put them at risk. So it might increase the morbidity and the mortality in such cases if they are fasting during the holy month of Ramadan. So these categories, that's the adults and young adults and older children and elderly who are on insulin therapy or injectables, they should not fast. They should not fast. But on the contrary, it is forbidden to fast from the religious point of view, because they put themselves at risk and there is increased the morbidity and mortality, and God didn't want that from us. The fasting of Ramadan is only a must and compulsory on healthy adults. To be clear, healthy adults. The sick in general, فَمَنْ كَانَ مِنْكُمْ مَرِيضًا, even God said that وَمَنْ كَانَ مِنْكُمْ مَرِيضًا أَوْ عَلَى سَفَرٍ فَعِدَّةٌ. Even being sick doesn't mean that, or it gets you out of the circle of compulsory fasting. That is, it is not wajib if you are sick. During the holy month of Ramadan, you should not fast at all. And you can compensate by giving charity, by compensating for every day, feeding a poor individual, and compensate for your inability to fast on a daily basis, as we all know from the religious point of view. So these categories, they should not fast. And also patients who are with uncontrolled blood sugar and high blood sugar levels, fasting exceeding more than 150 and postprandial exceeding 250 or more, they should not fast at all, because these patients are uncontrolled, and number one, they should put their blood sugar under control, and then after that they can fast. On the contrary, they should not start any fasting so long that their blood sugar is high, because the blood sugar might deteriorate more and they might be complicated by hyperglycemic, acute hyperglycemic problems like hyperglycemic coma, whether diabetic ketoacidotic coma or hyperglycemic hyperosmolar state in elderly diabetic individuals. So if the high blood sugar patient involve himself in fasting during Ramadan, he might get complicated by more deterioration in his hyperglycemia, and so he gets an acute hyperglycemic diabetic complication like DKA or HHS. So these patients all should not fast. Also, patients with active or recent acute cardiac events like unstable angina or like even chronic stable angina, which is on multiple medications, and the patient might get any cardiac insult as a result of deterioration of the blood sugar during fasting, and the patient might get acute cardiac event or acute cerebrovascular event due to sudden deterioration of the blood sugar, or more deterioration of the hyperglycemia during the fasting hours, so they should not also fast. So patients with multiple organ damage or associated comorbid conditions, especially diabetic heart disease or coronary heart disease or diabetic kidney disease with renal insufficiency or renal failure or impaired kidney functions, they should not fast at all. So in short, all patients and also patients who are already on multiple medications to control their diabetic state before the month of Ramadan, they are on a regimen containing 3 or more drugs for diabetes and other medications for hypertension and for cholesterol and for the heart and for the kidney and so on, they should not fast at all. Even patients who are on 3 or more drugs and without any other medications, the 3 or more drugs for treatment of diabetes, should not fast at all. Only patients who are mild diabetics, mild and early diabetics, who are on 1 or maximum 2 medications, they can be allowed, and they are type 2 diabetics, which is more common in adults. They can be allowed to fast. So type 2 diabetics, type 2 adults who are on 1 or 2 medications and with mild hyperglycemia or blood sugar under control since before the start of the holy month, they can be allowed to fast the month of Ramadan if they are type 2 on 1 or 2 medications maximum, especially if the blood sugar is under control, that is put under control since before, as I mentioned before, the most important that you control the patient before the start of Ramadan, so that he can start the fasting during Ramadan under more or less safe conditions. Under more or less safe conditions. He is not liable to get more deterioration of blood sugar, and he is not liable to have any complications during fasting during the fasting hours of Ramadan, and he is not liable to get any hypoglycemia or deterioration of his hyperglycemia if he was having uncontrolled hyperglycemia and he started the month with uncontrolled hyperglycemia, which is dangerous. That's why it's better to control the blood sugar and everything before the start of the month, rather than waiting till the month begin and then we search how can the patients start to fast and what medications we can give him and what is the doses and what is the frequency of giving such medications and so on, in order to avoid any further complications during the fasting hours, and in order to avoid any increase in the morbidity and the mortality of the individual, which is very dangerous. And this is not at all the purpose of fasting the holy month of Ramadan. So type 2 diabetics with 1 or more medications and more or less control the blood sugar can be allowed to fast. This is clear. this is the only group which can be clearly given the chance to fast, or we can advise them to fast with such conditions and under such circumstances. But in every case, we should give special instructions. So this is what I mentioned is general guidelines. Which patients are not allowed to fast? As I mentioned, all patients with type 1 diabetes, of course, because they are on 3 or more injections of insulins and insulin analogs, so they should not be allowed to fast at all. It is dangerous for them. And also, adults with very high blood sugar and adults who are liable to get hypoglycemias and adults and type 2 diabetics who are on 3 or more medications and those who are with severe hyperglycemias, very high fasting and very high postprandial blood sugar, and those who are with other comorbid conditions, that is diabetics with severe hypertension which is uncontrolled, or with coronary heart disease on taking many medications, all such categories are not allowed to fast Ramadan at all. It is dangerous for them. It increases their the deterioration and the progression of their underlying disease state, whether the diabetes or the hypertension or the lipid disorder problems they have, and they put them at increased risk of developing complications and even mortality, that is death, life-threatening to them. So this should not be allowed to fast during the whole month of Ramadan at all. And when we choose medications as regards the oral medications, only patients with, as I mentioned, with 1 or 2 oral medications, they can be allowed to. And in rare cases, sometimes when we are given in certain individuals who are taking one intermediate or long-acting insulin analog, sometimes we give them in specific cases. So as I mentioned, this is including in individualization of treatment. In specific individuals, we can give them we can allow them to fast during the holy month of Ramadan if they are taking one single subcutaneous injection, and we give them this injection before at the time of sahur, that is the light meal preceding the dawn and the start of the fasting day. So in such individual who is taking single injection and the blood sugar is okay, and the injection is given strictly at the time of the dawn, because here the onset of or the nadir of the lowering of blood sugar will not happen during the fasting hours, and by the time any further drop in the blood sugar might happen in such cases, which is given only one injection, single injection only, this is the only case which is allowed to fast. This nadir will not happen except or unless there is delay in the iftar or the breakdown of fasting, start of the breakdown of fasting. So there is no possibility of hypoglycemia happening before the breakdown of fasting, and so it's not dangerous, and so this individual who is taking single injection can be allowed to fast during the holy month of Ramadan. This is for and this only happens in the adults like type 2 diabetes who is given oral plus a single injection of insulin or insulin analog, or any of the other injectable medications used for treatment of diabetes. In type 2 diabetes, but as I mentioned, all type 1 are not allowed to fast, as I mentioned in details. This is, in short, the philosophy of how diabetic patients can manage themselves during the holy month of Ramadan. And as I mentioned, في مقاصد الشريعة for all Muslims who are fasting Ramadan, حفظ النفس is one of the most important purposes of the Islamic jurisprudence. That is to preserve the religion, to preserve the self, to preserve the mind, to preserve the integrity, to preserve the money, are the 5 purposes of Islamic jurisprudence اللي هي مقاصد الشريعة بنسميها in Arabic. فهنا anything which contradict with the purposes of the religion, of course, is not allowed and is forbidden and will be haram, including the possibility that you damage yourself. If you are having a chronic disease like diabetes and you are taking multiple medications, and if you are fasting during the holy month of Ramadan on these medications, you might get either hypoglycemia because you are on, especially on patients who are given insulin or insulin-like medications or insulin analogs, and they might get hypoglycemia. Although many of the current medications and injections and preparations which we are using, they have less incidence of hypoglycemia, but still there is a possibility of hypoglycemia in such cases, and we should not put the patient at risk of any possible hypoglycemia happening, especially hypoglycemia happening. And during the holy month of Ramadan, for the patient to be on the hyperglycemic side is better than to be on the verge of hypoglycemia or to put him into the possibility of getting hypoglycemia. So to be a little bit hyperglycemic or mildly uncontrolled is acceptable, sometimes acceptable, especially in people who are liable to get hypoglycemic complications, especially hypoglycemic coma. And this is especially true in the extremes of age, that is in pediatric cases, pediatric diabetics, especially the diabetic children who are older, who are allowed to fast, because the younger children and the babies with diabetes, of course, from the beginning they are not allowed to fast from the religious point of view. It's not allowed for them, even if they are healthy. What about if they are diseased and they are having a disease like diabetes and they are taking injections? Of course, we should not allow them to fast at all, those young people. And also same for the elderly, very elderly, and the geriatric diabetics who are liable to get hypoglycemia and who are on having a multiple pathology and on multiple medications, and fasting with such conditions and circumstances of having multiple organ damage and multiple diseases and multiple medications, if they are allowed to fast, of course, dangerous to them. And they might get complications, and they have increased rate of death, and this is life-threatening to them, so they are not allowed. Post the very old and the very young. In between, we can manage, we can see, we can start and discuss and take a compromise. The doctor advise and the doctor inform the patient, and then according to the philosophy of what we call the patient-centered care, and the patient has the right to choose and to put his preferences and to put his beliefs and to put his points of views into consideration to decide about the best approach and whether to fast or not, and what medications and what options we can give him during the holy month of Ramadan, doses and the duration and schedule according to his or her baseline disease status. Respecting the concept of what we call the patient-centered care, as I mentioned, which is a new concept in the healthcare profession, the patient-centered care. It's no more that the physician will oblige the patient, you have to do so and so, and it's like that. The physician is only an advisor. He is only an advisor to the patient, and the patient will decide about what to do. This is the patient-centered care. So the patient will have active role in deciding the therapeutic approach to his disease status, as I mentioned, will be active, not passive, and the doctor takes the active role. No. the patient should have. But so long that he is or she is given the proper information and the proper knowledge to be able to decide about how to manage himself or herself during the holy month of Ramadan. By this, I will end talking. These are general rules and general guidelines for the how to manage a diabetic individual and what to tell a diabetic patient during the holy month of Ramadan. And Ramadan Mubarak wa Ramadan مقبول إن شاء الله شهر رمضان ونتمنى and I hope for all fasting Muslims a blessed holy month of Ramadan and acceptable worships from them by the Lord, and I hope that everyone will be safe and stay peaceful and stay healthy and think well and be careful. Thank you so much. Have a nice day.